Symptoms of alcohol withdrawal can occur when you suddenly stop using alcohol after regular excessive drinking and can range from severe to mild. 1 Severe withdrawal symptoms can be quite serious, and in rare situations, they can actually be fatal. Because they can worsen over time, it's important to know whether your symptoms are getting more severe so you can seek help. The most severe symptoms usually occur between 2 and 5 days after you stop drinking, which means that the first day or two may not be a good indicator of your risk of serious problems. 1. Moderate versus excessive drinking. The Centers for Disease Control and Prevention, CDC, defines moderate drinking as up to 1 drink per day for women and up to 2 drinks per day for men. 2 Moderate drinking is considered safe for most people over the age of 21. A drink is generally defined as 12 ounces of beer, 8 ounces of malt liquor, 5 ounces of wine, 1.5 ounces of 80-proof distilled liquor or spirits, such as whiskey, gin, rum, or vodka. Excessive drinking is defined by the CDC as heavy drinking, binge drinking, or drinking that's done by anyone who is pregnant or under the age of 21. 3 Binge drinking means consuming multiple drinks during one occasion. For women, that's 4 or more drinks, and for men, it's 5 or more. Heavy drinking occurs when women have 8 or more drinks a week and men have 15 or more drinks per week. The majority of people who drink excessively do not have an alcohol use disorder and/or aren't dependent on alcohol. How withdrawal works: if you're a heavy drinker, even if you're not an alcoholic, you're likely to experience at least some symptoms if you stop drinking suddenly. 1 Most people use alcohol to relieve anxiety and relax. Alcohol provides this outcome by increasing the effects of GABA, a neurotransmitter responsible for creating feelings of calm and euphoria. It also decreases glutamate, another neurotransmitter that creates excitability. Heavy drinking makes it harder and harder to increase GABA and decrease glutamate, so more and more alcohol is required for the same outcome. Your body becomes accustomed to these changes and responds by producing more glutamate and less GABA. When you suddenly stop drinking, you are no longer impacting these two neurotransmitters, but your body is still overproducing glutamate and underproducing GABA. As a result, you may become hyperexcited, anxious, restless, and shaky. 4 If you are a heavy drinker, your symptoms may be much more severe, progressing to tremors, seizures, and serious high blood pressure. Common withdrawal symptoms: if you've been regularly drinking excessively and you stop drinking suddenly, you may experience 1 or more alcohol withdrawal symptoms. Depending on your past alcohol use, these symptoms can range from mild and uncomfortable to severe and potentially life-threatening. Though symptoms typically begin within 8 hours after your last drink, you may not experience any until several days later. These symptoms tend to spike around 24 to 72 hours after your last drink, though milder ones may persist for much longer in some people. Common symptoms include 4. Feeling anxious or nervous, feeling irritable, feeling depressed, feeling wiped out and tired, shakiness, mood swings, not being able to think clearly, having nightmares, dilated pupils, sweating, headache, difficulty sleeping, nausea and or vomiting, appetite loss, faster heart rate, pale skin, tremor. Severe withdrawal symptoms: one of the most severe consequences of alcohol withdrawal is called delirium tremens, or the DTs. About 3% to 5% of people who withdraw from heavy drinking experience delirium tremens. This condition can become fatal if it's left untreated, so if you or a loved one show any symptoms of the DTs, seek emergency treatment because symptoms can get worse. Symptoms of delirium tremens include fever, extreme agitation, seizures, extreme confusion, hallucinations, feeling, seeing, or hearing things that aren't there. High blood pressure. Hospitals and detox centers have experienced staff who are familiar with these symptoms and have the tools to provide appropriate treatment. Diagnosis: alcohol withdrawal is primarily diagnosed with a history and physical exam and often include blood tests to rule out other medical issues. Your doctor will look for physical signs and symptoms such as 1. Tremors in your hands, fast heartbeat, high blood pressure, dilated pupils, fever, fast breathing. Your doctor may also use the Clinical Institute Withdrawal Assessment for Alcohol (CIWAAR) scale to assess how severe your symptoms are. This scale uses 10 questions to measure the following symptoms: nausea and vomiting, tremor, sweating, anxiety, agitation, tactile disturbances, which are abnormal feelings in, on, or underneath the skin, auditory disturbances, which involve hearing, visual disturbances, headache, confusion. Treatment will depend on the severity of symptoms. Mild to moderate symptoms. If you have mild to moderate symptoms of alcohol withdrawal, you may be able to withdraw at home, but you need to have someone stay with you to make sure your symptoms don't get worse. You may need to see your doctor on a daily basis until you are stabilized as well. Your doctor may prescribe a benzodiazepine sedative such as Ativan, lorazepam, Valium, diazepam, or clonazepam, to help you get through the early days of withdrawal. You will probably be tested for other medical problems that are related to your alcohol use, and will likely receive counseling regarding your alcohol use. Moderate to severe symptoms. If your symptoms are moderate to severe, you will likely need to be hospitalized. Your vital signs will be monitored, you will have blood tests, and you may have intravenous, IV fluids to prevent dehydration. Your doctor may also use the IV to give you medications to help you get through the symptoms of withdrawal or to treat seizures or other complications. Long-term treatment. No matter how severe or mild your symptoms, the best long-term treatment is to stop drinking completely, especially when you've already gone through withdrawal. To that end, you'll need to make sure that you're living in an environment that's supportive to refraining from alcohol use. If you or a loved one are struggling with substance use or addiction, contact the Substance Abuse and Mental Health Services Administration, SAMHSA, National Helpline at 1-800-662-4357 for information on support and treatment facilities in your area. For more mental health resources, see our National Helpline database. Outlook. The majority of people experience a full recovery from alcohol withdrawal symptoms. Some people continue to have disruptive symptoms known as post-acute withdrawal for months, such as difficulty sleeping, fatigue, mood swings, and fatigue. A small percentage of people die from delirium tremens. 0.5. If you have underlying medical conditions, you continue to drink heavily, and/or your organs are damaged, your recovery will be more complicated. Heavy drinking damages your organs and can lead to heart disease, liver disease, and nervous system problems, so it's important to get help and treatment if you're having a hard time abstaining from using alcohol. Predicting withdrawal symptoms. You may be wondering how severe your withdrawal symptoms could be if you quit drinking. The answer to this question will depend upon many factors: your size, age, gender, drinking habits, and genetics, among others. 1. You can get a good idea of your risk level, however, by taking a quick quiz about your symptoms. The test is completely confidential and anonymous. Your results are not recorded, are available only to you, and you are not asked for any personally identifying information. It can also help if you've recently stopped drinking and aren't sure how serious your withdrawal symptoms are.